Okay, I'm at the Oceania Tobacco Control Conference pre-conference workshop, and I'm talking to Rae Fry, who is here from Cancer Council New South Wales. Can you talk about your role there and what you were talking about today?
I'm the Senior Research and Evaluation Analyst in the tobacco team at Cancer Council New South Wales, and part of my role is to evaluate the Tackling Tobacco program, which is a partnership program between Cancer Council New South Wales and community services. So we work with not-for-profit community services, and our aim is to work with them to change the way that they work so that they help support their clients to quit smoking or cut down if their clients wish to.
So you talked about two case study examples which you said were shining lights. It'd be really good to talk about them in detail in a minute. But what are the issues that you have to address first when you start to work with the community sector? You'd think they would be completely on board. What are the issues?
Well, the community services sector traditionally has not worked on smoking as a priority. And that's really because they're working with people who have a lot of other stuff going on in their lives. So serious financial hardship in many cases, serious mental illness, drug and alcohol abuse, at-risk families and youth are some of the populations we work with as well, Aboriginal people. What these groups of people have in common is that they all have smoking rates that are much higher than the general population. So although it's really important to support those groups to help quit smoking if they want to, it's difficult because of all the other stuff that's going on in their lives. And community services sector traditionally hasn't done that work because they've thought, well, that's not our first priority. Often our clients are in crisis, they've got a lot going on, and it's not easy to quit smoking. So what we really need to do is to take advantage, though, of the wonderful relationships that those services have with their clients, their trusting relationships, their ongoing relationships. And community service staff, who are traditionally, say, social workers or support staff, are very skilled in working with clients in a holistic way and all the things that are happening in their lives and improving their well-being across the board. Smoking is a really important part of that. So in spite of the fact, say, that drug and alcohol users might have a very high, very high risk because of their drug use, actually it's probably more likely to be tobacco, the statistics suggest, that is really likely to be most harmful in the end. So although it's tough to work on smoking, it's also really high priority for those groups. So what we say, what Cancer Council says, is that it's not just a health issue, it's a social justice issue. Traditionally, those groups don't have the same access to quit services as the rest of the population. So we know that they underuse health services, so they're less likely to go to the GP than the general population. If they do go to the GP is less likely to ask them about their smoking or ask if they're interested in quitting than the general population. So it's really an equity issue to offer at least the same level of support as the general population for those people, if not more.
So I'm thinking these two case studies give examples of why that, or of how you go about addressing those issues. Can you run through them for us?
So yeah, the first service I talked about was Triple Care Farm, and that's it's a national leader in providing youth rehab. It's a residential service in the Southern Highlands of New South Wales. It's a very beautiful rural property, and they run a 12-week program for young people aged 16 to 24 with substance abuse issues. So most of those people who are coming to Triple Care Farm also have mental health issues, and 98% of them are smokers on intake. So what they provide is a very holistic program. It's residential, but they also provide training, help with leisure activities. So, if we're taking away drug and alcohol dependence, then we're replacing it with something more enjoyable and productive, which is, affordable and sustainable leisure. And along with that, of course, the intensive group counselling and individual work that helps them work with their substance abuse issues.
And you said they sort of went through this phased thing of punishment for people and breaches and things like that. In what ways did they change their practices?
So what they decided to do initially was they offered one of their residential cottages. So they have 3 cottages. They offered one of them as a smoke-free cottage. But at first that just created a problem because they had more students wanting to be in the smoking cottages than in the non-smoking cottages. And so they kind of let it go for a while because it was a bit in the too hard basket. But when the manager looked around one day and she saw that she had a staff member who was quite pregnant, surrounded by people who were smoking. So that's a serious occupational health and safety issue, obviously. And she realised then that they really had to do something about smoking, both for students and for staff. So what they did was they undertook a 6-month consultation process internally to decide how they would approach going smoke-free. At first, they were keen to not be too punishing. So they wanted students to know that the second chance was there. So at first, they had a stage process of first strike, you get a warning, second strike, you get a short suspension, third strike, you get a longer suspension. But they found that that just wasn't working, partly because it was not being applied consistently and it was difficult for different staff to document, you know, how many breaches there had been. And also partly because students were kind of using up those 3 opportunities to smoke. So they decided very quickly that because that wasn't working, they would change it. So within 2 months, they went completely smoke-free. And they then decided to treat smoking like any other substance, which is that if you're using it in the program, you have to leave. You can come back in, but you have to go back to the bottom of the waiting list. And they were concerned that that would, you know, stop people wanting to come to Triple Care Farm for treatment. But they followed their recruitment and their retention rates very closely, and they discovered that it had no impact.
And in fact, too, the stats about the number of people coming in who were smokers was quite
98%.
98%.
Yeah.
And the follow-up of that was when they had left.
So yes, they keep very good statistics of students who participate in their aftercare program, and they found that 6 months down the track, 21% were still not smoking. Now, of course, none of them were smoking when they left the program, and you might think, oh, so that means that 80%, you know, started again. But actually, 21% is an amazing success rate. Even for the general population, that would be an amazing success rate. So for this group of people, that's really very impressive.
Now, I won't keep you too long on the second one, but I think we all responded most to the second example of a youth refuge, I think, in New South Wales, of looking at ways to break that sense that it's a social life to smoke with other people in those sorts of facilities.
So this is a small youth refuge in Canterbury Bankstown, and it's just one small house. People can stay about 3 months for 16 to 21, I think, year olds. And what they did was they were concerned, the staff were concerned because some of the residents who were coming into the house were not smokers but were taking it up while they were there. And then some who were light smokers were becoming heavier smokers while they were there. So they were like, this is not what we're here to do. We're here to create positive change. So the problem that they had was that smoking was very social activity at the refuge. People were allowed to smoke anywhere outside, and that was, you know, the main kind of social activity. So what they decided to do was to make a designated smoking area that was a little patch of concrete in the backyard, very uncomfortable place to be, and only one person could use that at the same time. If there was anyone else in the garden, they had to go inside while the person was smoking. So that became a kind of a self-managing thing where the students did not ask people to go inside if they wanted to have a cigarette. They waited. And so, again, free nicotine replacement therapy was available on the site, so people would use the nicotine replacement therapy and go longer between cigarettes. So it really helped people either to quit or to cut down seriously.
When you say they're shining light examples, what are the take-home messages then from them?
So the thing about those 2 services that have been so successful in implementing these changes in a really integrated way, they don't just say, you must not smoke here. They really support people in their day-to-day casework. So they have a conversation about smoking straight away with the caseworker when people come into the program. They provide free nicotine replacement therapy on site, and it's part of the care that they provide to support people to quit or cut down. And the other thing that they've done, I think, that was distinctive about those 2 services, they both have very strong internal leadership and very strong internal consultation, and they've allowed the time to work out what approach is going to work for us, our staff, our clients, and the services that we provide, and to think it through in terms of what's feasible to implement.
And do you use them now to promote similar policies across other community service areas? And can you say sort of, how broadly you've gone?
So I think, we work with a lot of different kinds of services in tackling tobacco. So youth services is just one. Drug and alcohol, mental health, Aboriginal programs for at-risk families and homelessness services as well. And they're all quite different. So I suppose what's useful about these examples is to help services who have not started doing this kind of work think about, well, how might that work for us? Could that work here? And it helps make something that's kind of abstract concrete, and learning from other people's experiences is always such a good way to learn.
Thank you very much, Rae. Fantastic to hear about them.